Yeah, it's great to be here. Thanks, Gabby. I am a pediatrician and I had a private practice for a number of years up until 2011 when I moved to Hong Kong to raise my four kids, three at the time, and then I had my fourth there. While in Hong Kong, I started training in conscious parenting. So I've spent now it's been almost 10 years in training for conscious parenting, which is a more of a guidance approach to parenting. We also really focus on learning effective communication skills and a lot of mental health strategies as well, managing stress and triggers, how to have conflict resolution, how to create basically good relationships within your family and with other people. So I trained in that up until 2020 when we returned to the US. And since then, I have kind of delved into a lot of health and wellness spaces. So I've become a CrossFit coach. And I also have trained in precision medicine, health and wellness coaching. And I also did some work with a Harvard psychiatrist, Dr. Chris Palmer, on brain energy, basically the link between metabolic and mental health. So yeah, I've been in this space for a while, all alongside raising my four kids. And yeah, it's great to be here and to be a part of this program and Dawn Health, and just kind of really working towards creating just a better family system, a more supportive system, more support. I think the thing that struck me coming back from Hong Kong was really the crisis we're in the mental health space, adults, children, everybody across the board, and also our metabolic health. And that's where the work of Dr. Palmer comes in a lot, of really linking those two, that there's definitely a connection between both of them. So my passion lies, really in helping support people, kids especially, but also like the families, because we're all together, right? We're all part of this together. So really helping them with their mental health, coming up with good strategies, feeling supported, and also the link between that, your mental health and your physical health are so intertwined, and to really take care of the whole person. So it's great to be here. Our healthcare system is a sick system, meaning we just look at disorders and diseases. Unfortunately, the system hasn't been set up for preventive care and really addressing things before they become bad, right? Really promoting health and wellness and a comprehensive approach to that. So, and that's what, sets Dawn Health apart, and really being preventive about what's going on with your health. So as far as the intersection between mental health and metabolic health, I think we often separate the brain as just a different part of our body that's not affected by everything else we do, in a sense, right? So the mental health part, we should really start looking at it as our brain health, just like we look at cardiovascular and heart health, just as we look at gut health, right? And we know it's easy, right? We know that people say, oh, your diet is so important for your cardiovascular health. Your diet is so important for your gut health, sleep, exercise. These are easy things for people to get this concept of like, yeah, that's good for my lungs. That's good for my muscles. That's good for my heart. And we have this disconnected that it's good for our brains and our mental health. So, and the fact that, all the way down, I won't get into the science of it, but all the way down to like the scientific level, our nutrition plays a huge role in how we feel, and our mood regulation and neurotransmission and all those things. Sleep is critical to how we function, how we behave, how we can handle stress. Exercise also is a huge component to that as well. There's just countless benefits to exercise. Also, breath work, learning how to manage how we breathe is really important. So all these components are so crucial to how we show up in this world mentally, right? In our daily, whether it be from, how we behave, how we can function, how successful we can be. And I think a lot of people can see that in themselves, and in the sense of we know when we're tired, when we're hungry, when we've been sitting all day, that we don't feel good. And it's easy to see it in ourselves. And then when we look at a child who's having behavioral issues or not doing well at school, I feel like we miss that connection. We just think they're behaving badly or they don't care about school. And we miss this connection of they could be, and most likely are, suffering from the same things we are: not sleeping, not eating well, being on social media all the time, drinking too much caffeine, not exercising, right? But we tend to attribute their quote unquote poor behavior with just them being bad, not caring, all these negative connotations, and not really looking at really what's going on and the bigger picture. And that, oh my gosh, they didn't sleep. That's going to contribute to their behavior. And there's so many studies out there really that show that, there's so much, there's poor concentration, there's ADHD like behaviors, not necessarily that they're diagnosed with that they actually have that, but they just can't focus because they haven't slept, they're eating maybe nothing but sugar, they haven't exercised, they've been sitting all day. So I think that's where this kind of combination, we really have to look at that, because I think it's easy, like I said, it's easy for me to know when I'm tired and I'm hungry and I'm cranky and I can't focus. That's easy for me. I don't look at myself and say, oh, I'm behaving badly, I don't really care about this. It's like, wow, I need to sleep. Wow, I need to eat. Wow, I need to get off social media. And so these are really crucial components that I feel like are being missed, especially with kids. And so that's where I think this comes in, where we can really create that support system in supporting these these really important components of our metabolic health. And there's a lot of science behind it that I won't get into, but there's a lot of science that goes down to really how important this all is for how we show up with our feelings and our emotions and our abilities to function and be successful and do all the things we want to do. So. Yeah, it's a great question. And it is complex and there's lots of components to it. Obviously, I mean, I've been doing this for 10 years and still learning a lot of things. But so the conscious approach to parenting really focuses on a guidance approach. So we see it as, and this is going to be a hard thing for a lot of people to kind of understand. I think understand, but not hard, but just most of us have grown up in a system where, when we were growing up, that we were being controlled, that we were being told what to do, right? And there's this negative view of children, meaning kind of what I alluded to before was that there is this feeling of like kids' behavior is because they're being bad or disrespectful or all these negative connotations, these judgment words. And what we really focus on is everybody's behavior. It comes down to your behavior. Everyone's behavior comes down to these unmet needs, right? You're behaving in a way to get your needs met, whatever those needs are, right? Whether they're like your basic core needs, and we talk about like the hierarchy of needs, your basic survival needs, food, sleep, water, things like that, psychological safety, belonging. There's these core needs that we all have: community, feeling like you belong. That's a huge need, right? Obviously our survival needs are the basic. So we are behaving in a way to meet those needs, whatever that behavior is. And we look at behavior as a signal, right? This is just information to us that something is going on, right? That there's a need not being met. There's something like that. So for the guidance approach, for a controlling form of discipline, which a lot of us grew up in. And so this is kind of all we know, right? And I always talk about with parents is we get thrown into parent, or we decide, or we choose, or whatever, where we start becoming parents and we think we're supposed to know exactly how to do this, right? Like this is just like an innate thing that, oh, I know how to parent. Well, it's a skill. It's a skill to learn anything, just like it's a skill to learn math, just like it's a skill to learn how to do a cartwheel, just like it's a skill to learn how to throw a football. It's a skill. But mostly we default to what we've learned, right? Or what's ingrained in how we were raised, which is often controlling form. Not always, but a lot. Do what I say, just because I said it, just because I'm the parent. just because, we have this sense that we actually have control, which we don't. So, that's part of it. And then also societal, obviously there's societal pressure, right? And there's this kind of, even in schools and things, this rewards and punishments, right? And just kind of this pervasive way that we have grown up in. So with the guidance approach, we are here to guide our kids and support them. Now, does that mean, sometimes people say, well, if I'm like that, it doesn't mean you're permissive. It doesn't mean that you allow them to do, because I think a lot of people say, well, if I don't control them, if I don't do rewards and punishments, if I don't do all this, they are going to be walking all over me and there's going to be no right control in my house and things like that. So the guidance is in the middle. So we're not becoming permissive, because what happens is we create this resentment cycle. So in a controlling form of discipline, and there is like a lot of research with this, you create the 3 R's, which is rebellion, resentment, and retaliation. And I think any parent that knows, that tries to do this, and we all have, I have, right? When you're trying to control somebody, they're going to respond with resentment, retaliation, or resistance, right? So and that creates what? A disconnect in your relationship, right? Or the other flip side, that's usually with an autonomous, independent child. So on the flip side, you have a people-pleasing child, who most parents come into our course saying, oh yeah, that's the easy kid. They do whatever I say. And that's really dangerous. And it's easy to parent that type of child, yet you're actually creating a system where this kid is a people pleaser and will do what anyone says, right? And that's actually quite dangerous. And there's a lot of nuance and there's a lot of discussion around both of those. But the conscious parenting is really seeing your child as their own independent human. They are their own person. They are not you in any way. They are part of you, of course. And a lot of parents, they see resemblances and in personalities, but they're not you. They have their own journey. And this is, I think, the biggest challenge, is to really realize as a parent that this is their journey. This is not your journey. They're different than you. And so I'm here to guide them in the best way that I know, based on my experience, based on my knowledge, based on the fact that my frontal lobe is developed and I have all this experience and they don't, right? A 2-year-old doesn't know that running into traffic is dangerous yet, right? That's what we're there for. So it's this guidance approach and creating a safe space for your kid, that they don't feel like they're going to be controlled. They're going to be told what to do, that you are there. And I'm not saying you have to be, there's this argument about being friends and this. No, this is like, so you have created this safe space in your house that your kid knows that they can fail and mess up and they're not going to be yelled at, punished, and that you will help guide them through this difficult journey that's life, right? And all these things that they're going to come across, right? These challenges that they're going to face. So we really, in the conscious parenting and the guidance approach to parenting, is we really honor who they are, right? However they're showing up in the world, they're trying to navigate their emotions and feelings. And I'd like to remind, all the parents, is that their brains are not developed either, right? They're navigating this world with a brain that is not fully developed and has to have all these experiences and time. I mean, for the frontal lobe to be developed in women, it's like early 20s, men, it's mid to late 20s. And so for these decisions to really, for them to really make really good decisions all the time, it's just not there yet. It's not. And I always compare it to saying, you wouldn't punish a 6-month-old for not being able to walk yet. They're developmentally not there. Like that's ridiculous, right? It sounds ridiculous. Like, of course I wouldn't punish a 6-month-old for not being able to walk. That's just not that's not possible at that point, right? And the same goes for children, especially teenagers, which is a challenge, right? Because yes, they're going to make bad decisions, and we can help guide them in those decisions, and we can help them make less bad decisions. Their brain's still not developed fully either. So it's kind of recognizing that. Now, does that mean we're okay with all their behaviors? Of course not. Of course not. We're not going to sit there and say, oh, that's okay, it's because your brain's not developed. It's just like, okay, how can I help you navigate this? Because you're not there yet. You're not there yet to be able to make the decision and kind of go through the steps that we would go through as adults, right? In this. So let me help you with that, right? So it doesn't mean you're excusing behavior necessarily, or behavior that you're not okay with. It's not that you're letting them do whatever they want. It's that you're guiding them. And at the core of that is they have to be able to feel safe in your presence and in your family, to be able to make the mistakes, and for them to have, for you to be able to have the influence in their life. That's what you want. Ultimately, you want to be able to have that influence, right? Now, are you going to be able to control all their behavior? Of course not. That's a delusion that we have, and probably all of us have in different aspects of our life, right? That we feel like we can control all these things, and we just can't. Can we have influence? Absolutely. Can we have influence if we're always controlling our kids and they are resentful and they are retaliating against us and they've basically fired us as parents? No, that's not where you want to be, right? So, there's a lot of, I can talk about this for a while, but that is really the core of it, is removing judgment from their behavior and just observing their behavior and wondering to yourself, why are they acting like this, right? Not saying it's bad or good or right or wrong. What is going on for my child that they're acting in this way? A lot of times, honestly, for me, when I see some behaviors that are signaling that are ugly, that I don't like, to be honest, a lot of it comes down to those basic needs for my kids. They're tired. They haven't slept well. They've been sitting in front of a screen, maybe. They haven't gotten outside. They're not eating. They haven't eaten. A lot of that comes to it. I mean, obviously, there's other reasons too that are deeper, and sometimes that takes some time to figure out. But a lot of times, it's just solving those basic things. So, yeah, there's a lot more to it, obviously, but those are kind of the core and how we approach it. And really, you create kids who become more compassionate and empathetic, because once people feel heard and seen, they can actually do that for other people as well. So that's another component of it. Yeah, I love that question. Thanks. So the building resilience, that really comes down to what I kind of alluded to before, is building this psychological safety. So psychological safety, obviously physical safety is crucial, but creating a psychologically safe place for your kid will allow them to feel safe enough to make mistakes, and that is how you build resilience, right? So building resilience is failing and getting up again, and failing and getting up again, and also having discussions on how to resolve problems, right? To problem solve. So that's something else we go about in conscious parenting. So after the initial fail or initial blow up or whatever is happening with your kid, for example, a failure on a test or a failure in a sport or a friend situation, these are all very common situations. After kind of getting through that, after listening to your kid, or even a fight with you, right? Or an argument with you, going back, and I usually sometimes, like, if there's a lot of high emotion in the moment, that's not when you want to do this. But in another instance is collaborative problem solving, right? Hey, that test didn't really go very well for you the other day. You were really upset about it. Are you ready to talk about how maybe I can support you in doing better the next time? What do you think was the biggest struggle for you? How do you think? This is not how do I think he should do it better, right? My son or my daughter, usually my son, one of my kids. But like, what do you think didn't go well for you? How do you think you can do better next time? What kind of support would you need? Having them come up with the solutions is key in many ways. For building that resilience, being like, okay, I can figure this out on my own, right? I'm not being told what to do. And B, if they come up with the solutions, they are way more likely to do that, right? Instead of being told what to do. And I will guarantee, like, anyone listening, no one likes to be told what to do. Nobody I've come across, unless you're actually asking for advice, right? Saying, hey, I really could use support in this. That's different. But to be told what to do is really tough. Like, I don't like it. Because then you feel like, wow, this person doesn't believe that I can come up with a solution, right? This person doesn't believe, they think they have to tell me what to do, right? So I think allowing your child to come up with solutions for their problems is huge. And that's what builds resilience. You know, there's a lot of different components to resilience and grit, and that's a whole nother discussion. But really having that safe space where your kid can have the meltdown, right? They have all the emotions, they don't know what to do with them, to be able to have that meltdown, to be able to fail, and to feel like, wow, the world is not safe, right? The world is scary. It's hard. You need to have a safe space for your kid to come home to. That's just the bottom line for me, is they need to feel safe that they can come back and be like, wow, I failed that test. And I can go tell my mom that, because I know she's not going to yell at me. She's going to have compassion and empathy. Not that she'll necessarily be happy that I failed this test. I'm not happy. The kids are not happy. Like, just generally, you know, people are not happy to fail, and that's hard, right? They already feel bad. So, you know, not that I'm okay with that necessarily. Wow, but that's a signaling behavior. Something's going on in that class. Something is going on with that, the howling the learner. So that they can come to me and say, I failed that test, and they're not going to get yelled at or told that they're terrible or they're stupid or anything, and saying, wow, like, that's really hard. That's tough. And then kind of coming up with the solution. So in any aspect of life, teaching them that, hey, I have a safe place to go. Someone's going to love me no matter what. That's huge. Someone's going to believe in me no matter what. Because we all fail. We all mess up. And so to think that our kids are going to be immune from this, as much as we don't want them to be hurting, and as much as that is the hardest thing as a parent, to see your kid in pain and fail. It's one of the hardest things I've had to navigate, because it's the last thing you want, and yet it's going to happen over and over again. And so it's really being able to sit with them in that pain, in that failure, knowing that they're not alone. That is that's just huge, to be like, you're not alone in this. We'll figure this out. You know, this sucks. Like, this is hard, whatever the situation is. And to have somebody who has your back no matter what, and who's not going to turn around and be critical and stuff like that. And I'm not saying, you know, it's not perfect. We all have our moments, and that's a whole nother thing about how to repair and when you kind of mess up as a parent. But having that, and then going back and saying, okay, let's figure this out. Like, and then also kids can look back and say, wow, I had this really hard thing. That sucked. I wasn't alone. I figured out a solution, or whatever, even if, or maybe there wasn't a solution, but I got through it. And that's how you build that grit and resilience. And I think with Dawn Health is we're seeing, you know, kind of back to your question of like, how does Dawn Health, you know, is doing this, is we're looking at the preventive, right? We're creating these skills for parents and for their kids. And we're helping support create these dynamics, the psychological safety, so that when kids are faced with challenging things, when parents are faced with challenging things, that we have the tools to be able to have these hard conversations, that we have the tools to be able to build this resilience. And so I think kind of the care team, the social workers, therapists, and the coaching that we're going to have creates these safe environments for parents and kids. Like, this is a journey for parents as well. And so to create these, it's skill building. This is skill building, you know, across the board. So I think, and having access to, the resources and the support to build these family systems that are safe, right? And creating, you know, these tools for the kids, right? And and then also, you know, once you start recognizing and being able to have these conversations with your kids, you build up trust, you build up connection, you build up a family system that is solid, because you're going to come across bad things. Bad things are going to happen. Hard things are going to happen. You're going to come across difficult situations. And so to be able to be in a system where you can have these conversations, and you haven't been fired as a parent. That's the worst. We've had, I've coached parents who come in and they're like, I'm totally fired. They don't listen to anything I say. That's the worst. Like, that's the most heartbreaking and difficult position to be in. Right. So to rebuild that and kind of create these family systems, and that's where Dawn Health definitely can come in and really create these care teams that provide the support for families, because it's hard, and it takes time to learn these skills, and to just have, and that's what, you know, Dawn Health is going to do, is create the safe space, right? So then families can go and create these safe spaces. So. Yeah, absolutely. I mean, they're going to fail inevitably. Like whatever, right? Whatever, like whatever you do, there's going to be failure. There's going to be pain. I think the hardest thing for me as a parent, and we talk about this a lot in the course, and this is, you know, very a nuanced thing, and more kind of beyond the scope of this discussion right now, but something that is really important to understand. And I was just talking about this with a parent the other day, this fine line of controlling your kid, like having this kind of controlling form of discipline, but versus a protective use of force, right? So this is a very fine line. So your kid is going to do something dangerous. Obviously, like an easy example, 2-year-old running in the street. What are you going to do? You don't care. You're going to grab that kid no matter what it takes. You're going to, like, even if you have to pull the arm a little bit hard, whatever, that's a protective use of force, right? You know, but you know, with teenagers especially, it's like the drugs and the sex and the difficult conversations, the social media, like it's a very fine line of, okay, I'm doing this because I want to protect you, because this is actually like, this is scary for your life, versus I'm just trying to control you to do what I want you to do, right? And this is very difficult. So I think to your point of creating that safe space, if you are always controlling your kid, they're always going to see it as controlling, even if you're using a protective use of force, right? So, but if you create kind of the safe space and your kids don't feel like they're in a controlling environment, then I think you have I know you have the buy-in to talk to them about the hard things, right? So I think that's one thing. The other thing, so I think for me, the most difficult thing personally was when I've had some really heartbreaking things to watch my kids go through, and for me to remove my, like, to just be there with them in their failure and just be like, this is hurtful. Obviously, this is hurting me because I love you so much, but also just to be there and be like, acknowledging that this, you know, just to be there in their space, not try to fix it, not try to tell them it. I think one of the biggest things is in their failure, in their difficulty, is to not say it's okay. It's not a big deal. It is a big deal for them, whatever it is. Whether you think it's a small fail or it's, you know, or not, it's what they're experiencing. So I think not dismissing their feelings. I think just being in there, and I mean, in their pain. I've had to sit with one of my kids, you know, for hours as he was kind of working through something, and just being like, yeah, this is hard. This is really difficult. And even though in your head as a parent, a lot of times like, okay, I can do this and I can fix this and I can do this and this is how I'm going to make it better. Like in that moment, that's not your job. And so I think acknowledging that. And so I think the stepping in part, like what you were talking about is, you know, is to just be there, and listen and let them be heard. And I actually had a friend of mine who called me, and she's really struggling with her 16-year-old, like a lot of struggle. And he broke down one night and he told her, he said, can you just listen to me? Can you just not talk? You know, can you just hear me for once? So I think we forget how powerful it is, because she was like, I was just trying to fix it because it hurt so much for me, right? It hurts for you. Like it hurts for you. You want to just fix it. And so I think that was really powerful for her. She said, wow, I just listened to him for 2 hours. And I said, that's all you had to do. People just want to be seen and heard and understood. And it's no different with kids. And so, and then I think it goes back to like, when do you step in? Obviously, if it's a life situation, the protective use of force, that's kind of a different conversation. But going back to it later, like I talked about, like going back to it later and saying like, how can we avoid this fail next time? Or, you know, like sometimes you can't, but how can we fix this? How can we do better? How can we do this? But not when they're in that, right? Letting them kind of let those emotions. And there's a lot of different strategies for helping them work through that, right? And that's some stuff that, we can talk about, Dawn Health will do that with the coaching, is like, some breath work. Maybe your kid needs to go out and exercise, take a walk, kind of different strategies. So I think the key takeaways and the things like the starting, like this is, I think the starting points, I would say, because this is such a journey, like it's long, but the journey to like learning how to be more conscious around how you parent. I mean, it's been a journey for me. I think that the main points is one, I think you have to realize that this is going to be a process, right? We start off, we're unconsciously unskilled. We don't know what we don't know, right? And then you become conscious, like, wait, I want to do this better. How do I do this? You're going to be consciously unskilled. You're going to know what you need to do, but you're not there yet, right? And then you're going to be, then you're going to kind of move up into the consciously skilled. So you have to think about it. You have to do the work. You have to figure out the tools, right? And then hopefully at some point you'll become unconsciously unskilled, where you just do things like we walk. We don't think, we walk, we run, whatever, the things that you've learned that you don't have to think about, right? But it's a journey like that. You're never going to kind of always be at that top. Even as long as I've been doing it and people I work with who have been doing it longer, even if like I'm unconsciously unskilled in some things, I'm not in others, right? So it's just this, it's going to take time. Now, I think the first step is like, wow, I want to start on this. I think the first thing is number one is to remove judgments. So start observing. So one of the quotes that we go by is the highest form of human intelligence is observation without judgment. I probably didn't get it exactly, but it's observing without judging. My kid is having a tantrum. My kid is struggling right now. My kid's, yelling. That's just an observation. Not my kid is bad. My kid is disrespectful. Those are judgments, right? So starting to just look at your kid, your child as their own person with their own experiences. And if there's a behavior that is ugly to you, I want you to start just stepping back, depersonalizing it. It's not about you. And number two, it's not about you or how you're parenting or you as a person or any reflection of you as a parent. And just step back and say, wow, I wonder why my kid is acting like this. I wonder why. Just ask, be curious, not judgmental. Be curious. What's going on for my kid right now that they're struggling, that they're yelling, that they're not doing their homework, that they're going out with friends that are, not great for them. What's going on? Ask questions and be curious. Like, be curious about what's going on, I think is, some of the first things. And then how can I create a safe space for my kid? Right? So the biggest thing too is if your kid comes to you or there's a situation and you find yourself being triggered by that, I would really encourage taking a moment and not reacting. This is your responsibility as a parent, as any human, and this is what I teach my kids. Your reaction is your responsibility. So, and that goes for you, right? So, I obviously siblings hitting each other. Well, he hit me. Okay, but what you did after that is your responsibility, right? You hitting back or walking away like that. So it applies for parents. So taking that breath, being like, notice what's going on for you. What's going on for me that I'm getting triggered by this behavior? Removing yourself. I don't know, writing down what's going on for you, coming back to it. I've even done that with my kids. When I'm tired or I'm having my own moment, I've said to my kids, hey, I'm not okay with what's happening here, but I actually find myself that I'm really getting upset and I don't want to yell and I don't want to make this worse right now. So I'm going to take a step away until I can figure out how I can handle this. I've done that so many times. And then you come back. It's not saying and then let's deal with this, right? Or I'm not okay with this. So I think it's all those things, and creating the safe space is going to be really important. So really give yourself some grace and kindness and compassion that this is hard. This is really hard to be a parent. And really try to observe rather than judge. Be curious about what's going on. Try to see your kid's behavior, your partner's behavior, anyone who you work with. What's their behavior telling me? Like, what's going on, right? How can I be more curious about this? And really listen, try to hear them, see them, and understand what they're coming from their perspective. So I think those are some good steps. It's as you can see, it's a lot. We could definitely continue and we could do a lot in, talking about how to attain these skills, right? To have these conversations and to create the safe space. So those would be the big takeaways. And I think that all these moments are going to go to creating kind of a better relationship, and your kid will feel supported and safer, and you can manage kind of whatever challenges are coming up.
Absolutely.